Hello friends, welcome back to my channel. Hope all of you are doing well. Today's video is about healthcare in Canada. How does Canadian healthcare system work? The 1984 Canada Health Act set standards that still guide Canada today, including 5 founding principles: public administration, this is conducted on a non-profit basis; comprehensiveness, provincial health plans must cover all services that are medically necessary, though the determination of what care is medically necessary can vary by region; universality, all residents in Canada must have access to public health care; portability, residents must be covered while traveling within Canada and with limitations. While outside the country, accessibility, access to health services must be reasonable, uniform, and free of financial or other barriers. Is healthcare in Canada free? For Canadian citizens, permanent residents, and other eligible persons who have enrolled in their province or territory's version of Medicare, the answer is yes. Healthcare is free to a degree. Patients do not have to pay any fees to receive medical care in a hospital or at a physician's office. Covered services include childbirth, surgery, and prescription drugs given in a hospital. There are restrictions with Canada's public system. Prescription drugs taken outside a hospital setting are often not covered. Dental care, vision care, and rehabilitation services are also usually not covered by the Medicare. Medically unnecessary cosmetic surgery is not covered. Regional differences exist in coverage. For example, the province of Quebec provides prescription drug coverage, and there is also public programs to offer vision and dental care to seniors and children. But most Canadians rely on supplemental private insurance plans to handle medical expenses left out of Medicare. How does Canadian healthcare system work for those in the country who do not qualify for the public system? These people will need to pay for their healthcare themselves, either out of their pocket or by signing up for a private insurance plan. Though everyone, including tourists and short-term residents, will receive necessary emergency care, those costs are not covered by the Canadian healthcare system. Therefore, it's a good idea to have a great international travel medical insurance or international health insurance. Now, how to access and receive healthcare in Canada? The first step is to access Canadian healthcare is to determine if you can sign up for Medicare. If you are eligible, follow the enrollment process for your province or territory. In addition, remember that even if you qualify for this healthcare, not all medical services are covered by this public program. To make sure you have dental care, vision care, and prescription drug coverage, you may need to sign up for private insurance either on your own or through your employer. People in Canada who are not eligible for Medicare need to sign up for private health insurance in order to obtain health coverage. Fortunately, if you are an expat, there are several global healthcare insurance plans that provide care in Canada as well as you when you travel outside the country. Without insurance, healthcare in Canada is very expensive. How is healthcare in Canada for those without insurance? With no public or private insurance, patients are expected to pay for their medical care. Though Canadian healthcare costs are overseen by the government, uninsured patients can be charged higher rates. For example, one Ontario hospital charges non-residents hundreds of dollars more for healthcare. Signing up for general practitioner will ensure you have a provider to oversee your medical care. However, finding an office that is accepting new patients may be difficult, particularly in rural areas. If you need help finding a primary care physician, the health insurance offices in all provinces and territories have resources to assist you. There may also be immigrant serving organizations or expat communities that offer guidance. For those with private insurance, your insurer would be able to tell you about providers. Even without a primary care physician, you can easily access medical care in Canada. For non-emergency situations, visit a walk-in clinic or community health center. Services like Medimap are available to help you to find a clinic such as specialized care providers. If you require emergency care, you can call 911 for free. Emergency medical services will always be provided to you no matter what is your residency status. This is the case even if you don't have public or private insurance. However, you may be billed for any care you receive. Healthcare options for foreigners and expatriates in Canada. Everything has been explained in detail in this particular video. And if you are unable to understand anything, please do mention in the comments. I'll deal it separately. Canadian citizens and permanent residents, as well as some foreign workers on work permits and some international students, may apply for public health insurance from their province or territory. In some provinces, new permanent residents will have access to provincial health insurance coverage as soon as they arrive. In others, there is a waiting period for up to 3 months. Private health insurance can cover your needs during this period. Visit Bestcode or get free quote from Cigna to see which policies may be available to you.